mention of the CNS disorders. One of the most important areas which is asked in the exam is pertaining to the CNS tumors. And therefore, first we have a discussion about them. Perhaps then we talk about the neurodegenerative disorders. The first example of a CNS tumor I would like you to keep in mind, friends, is glioblastoma, which is an example of a WHO grade 4 tumor. Its importance lies in the fact that it is going to be very common and it is highly aggressive. So it is going to be the most common primary brain tumor that we are having in case of an adult. And the significance lies in the fact that grossly, if you see this particular tumor, it is going to be crossing the midline. Therefore, you are associating it with the term. It's also being referred by the name of a butterfly tumor. The same thing is something that can be picked up on the radiological investigations like the CT and MRI as well in the patients. What we need to remember over here is at a microscopic level, the tumor is going to be characterized by the presence of a infiltrative growth pattern, and there is presence of a serpentine or a zigzag kind of necrosis that you have over here. Around the areas of necrosis, the tumor cells are going to arrange themselves in a fashion. And because of the necrosis, the tumor cells are arranging themselves in a fence-like fashion. So this is given the name of a pseudo-palisading pattern. Right? So the terms butterfly tumor and the presence of a pseudo-palisading pattern or the presence of an endothelial cell proliferation, that is what is going to be associated with glioblastoma. Significance to like about glioblastoma is with respect to its aggressiveness, it's a highly aggressive tumor. So it's called as a grade 4 tumor and therefore it is going to be associated with a poorer prognosis. The second thing that we need to remember is a tumor which is also going to be derived from the astrocytes just like the glioblastoma, but this one is going to be called as pilocytic astrocytoma. Pilocytic astrocytoma is an example of a tumor which is going to be very commonly seen in case of children, and this tumor happens to be a benign tumor. So it is also derived from astrocytes, but difference number 1, age group is different. Pilocytic astrocytoma is a pediatric tumor. Difference number 2, pilocytic astrocytoma is a benign tumor. Difference number 3, pilocytic astrocytoma is a low grade or a grade 1 tumor. So it's going to be having a good prognosis. If you talk about the site where the pilocytic astrocytoma is going to be present, the pediatric pilocytic astrocytoma or the juvenile pilocytic astrocytoma is something which is going to be present in the cerebellum. So it is going to be present in the form of a cerebellar mass. That is what we need to remember. At a microscopic level, the tumor is characterized by the presence of PAS-positive eosinophilic fibers. PAS-positive fibers, eosinophilic fibers, which are going to be given the name of Rosenthal fibers. The moment you think in terms of a flower like rose, obviously you remember it is going to be having a pink red appearance. So eosinophilic color. So PAS-positive eosinophilic Rosenthal fibers are going to be seen as a feature of this kind of a disease. The third important tumor about which we need to have an idea is given the name of a meningioma. Meningioma is also an example of a benign tumor, and this is an example of a tumor more commonly seen in case of females, more likely to be seen in case of an adult, and this tumor is going to be arising from meninges. Now we understand that there are going to be 3 meninges, the pia mater, the arachnoid mater and the dura mater. So meningioma is going to be having its origin from the mid layer, that's going to be the arachnoid mater cells, right? Now this tumor is going to be having a radiological finding. It is going to be associated with a tumor attached with the meninges. So it is going to be associated with the term, the MRI finding, dural tail sign. Microscopically, the tumor is going to be having the presence of cells, and these cells can be having the presence of the meningothelial cells, having the presence of calcium deposition in this fashion. So as we made a mention of in our discussion earlier as well, this is going to be associated with the finding the presence of Psammoma bodies. So the brain tumor with the Psammoma bodies, that is what you need to remember so far as a meningioma is concerned. Interestingly, meningioma is also going to be having on its surface the expression of the progesterone receptor. Next tumor about which we need to have an idea is given the name of an oligodendroglioma. Oligodendroglioma is an example of a malignant tumor. The name gives you a hint regarding its cell of origin. The cell of origin over here is an oligodendrocyte. Quite commonly, patients are going to be having mutations in the enzyme, the isocitrate dehydrogenase enzyme subtype 1 and 2. Importance knowing about this tumor is going to be causing involvement of the frontal lobe, and this tumor is going to be having the presence of a calcification. Now, because you have an involvement of the frontal lobe, so patient is going to be having a disinhibited way of talking. At times, patients are going to be having the behavioral changes. So normally you think in terms of a tumor, you would think in terms of findings associated with increase in the intracranial pressure. But this tumor patient is also going to be having behavioral changes as well. So frontal lobe tumor, calcification, behavioral changes in the patient, increased intracranial tension and the presence of calcified mass on the radiological investigation, all that goes in favor of an oligodendroglioma. Whenever we are talking about this tumor cells over here are characterized by the fact that around the nucleus there is an empty area. So this is going to be associated with the term the perinuclear halo. The perinuclear halo, what is being described over here by the name of fried egg appearance. So oligodendroglioma, the way we remember it, oligodendroglioma, this is going to be having the presence of a fried egg appearance. That's what we need to remember. Talking then about a tumor, it's given the name of medulloblastoma. Medulloblastoma is an example of M for medulloblastoma, M for a malignant tumor. This tumor is going to be seen in case of children, and this tumor is going to be again arising from cerebellum. So what you need to remember is that the pediatric tumors, that is the tumors which are going to be seen in children, are going to be arising from C for cerebellum. That's how we remember and crack the questions. Medulloblastoma is a tumor which is going to be having an important finding. It is going to be presenting in the form of a midline posterior fossa mass. And this being a malignant tumor is characterized by the fact the tumor cells are going to be moving from top to down. So therefore, there is a CSF spread. That's point number 1. And fact number 2, it is associated with the term drop metastasis. At a microscopic level, this is an example of a tumor which is going to be having a neuroectodermal region, and therefore tumor cells over here are going to be small size tumor cells. They are going to be having the presence of extensive amount of chromatin in them. So they are going to be having an appearance, they are example of small round blue tumor cell category. These tumor cells, because they are metastatic in nature, malignant in nature, and having highly aggressive nature, they are going to be having high rate of mitotic activity. Tumor cells are going to be arranging themselves in a flower-like fashion, and therefore we are using a term for them. This is associated with the term Homer-Wright rosettes. Homer-Wright rosettes. Then continuation of a tumor that is given the name of a schwannoma. Schwannoma is an example of a tumor which is arising from the cerebellopontine angle. It quite commonly arises from the inferior vestibular nerve, that is the 8th cranial nerve, and you can be having its association with NF2 gene. At a microscopic level, you are having the presence of spindle-shaped tumor cells. There could be an area where the number of tumor cells are going to be more, so that's given the name of an Antony A area. And there could be a less cellular area which is given the name of Antony B area. If you look at the Antony A area, this is going to be having the tumor cells arranging themselves in a palisading fashion, and you would be having the presence of nuclear free zones which are going to be given the name of Verrucke bodies. So when you are reading those terms in the question of the exam, Antony A area, hypercellular area, Antony B area, which is the hypocellular area, and you read about a term which is going to be given the name of Verrucke bodies. Verrucke bodies simply means the nuclear free zones that you're going to be having, in a patient who's going to be suffering from a schwannoma. Please be familiar with the fact that if a patient is going to be having bilateral schwannomas, that is very much suggestive of a NF2 gene mutation that is associated with neurofibromatosis subtype 2. Having said that, we just talk about a tumor that is given the name of a CNS lymphoma. CNS lymphomas can be associated, subtype is usually going to be a diffuse large B-cell lymphoma. This can be seen in a patient who is going to be having an immunosuppressive condition. Say for example, a person is suffering from AIDS. And what we are having in case of a primary CNS lymphoma is that the patients are going to be having the presence of what is given the name of hooping. Hooping simply means that you are having the presence of elastin fibers. Please be familiar with the fact that a patient who is going to be having the CNS lymphoma, this can also be seen because of secondary conditions as well. But just remember the fact it's a primary variant which is going to be more common, so it's associated with immunosuppression and is going to be associated with hooping.